Nigeria is beset by recurring cholera outbreaks, a stark testament to the country's struggle with water, sanitation, and hygiene, which is abbreviated to be WASH. Infrastructure, cholera, a highly infectious and often fatal diarrheal disease, has become an endemic scourge, claiming countless lives and ravaging communities. The outbreaks, often triggered by flooding, poor waste management, and climate change, spread rapidly in densely populated areas, overwhelming healthcare systems and pushing vulnerable populations to the brink, with a case fatality rate of up to 60%. Isn't that scary? If left untreated, cholera poses a formidable threat to human life, particularly among children, pregnant women, and the immune compromised. As Nigeria grapples with this perennial public health crisis, it is clear that a comprehensive and sustained response is imperative to stem the tide of cholera outbreaks and safeguard the health and well-being of its citizens. Cholera is really killing. It's killing and it's not funny. Well, furthermore, Nigeria's healthcare system faces challenges in responding to cholera outbreaks, including inadequate surveillance, limited laboratory capacity, and insufficient access to oral cholera vaccines. Now, addressing cholera in Nigeria requires a multifaceted approach that includes improving WASH infrastructure, enhancing surveillance and response systems, and promoting community-based interventions to prevent and control these outbreaks. Okay, hello viewers, welcome to another educating episode of your favorite program, Health Watch, coming to you from ACNNTV. I am Promise Njoko Adibe, your host for today. And in today's episode of the program, we'll be looking at the topic cholera outbreak and its dangers to human life in Nigeria. And to shed more light on this topic is none other than Dr. Samuel Adedayo Shoni Bare, MBBS, DFM, and FMC PATH. I need to pronounce all of that because it's not easy to get those qualifications. He is a consultant, medical microbiologist, head of department also, and medical microbiology department in the National Hospital here in the capital city of Abuja. It's good to have you come talk to us, Dr. Samuel.
Good to be here.
Well, with all those qualifications, I'm sure your head is steaming.
They are very simple qualifications.
They aren't simple, else people will just pick them off the streets. Okay, so without wasting much of our time, we're talking about cholera. And we know, looking at the cases, the outbreaks that have been happening in Lagos and other parts of the country, it brings to mind what exactly is this cholera, and what's the current situation of cholera in Nigeria? I would want you to educate us on that, please.
Thank you. You have done very good job in the introduction. I'm sure I should just concur with what you have said.
Oh, okay.
Yes. That cholera is a kind of a diarrhea, is an acute watery secretory diarrhea, which is caused by Vibrio cholerae, the toxigenic strain of Vibrio cholerae. And this happens when people ingest food or water contaminated by this bacteria. And it's a rapid onset and highly voluminous kind of diarrhea. So within 4 hours, you can have somebody manifesting with dehydration. And that's sometimes within 24 hours, 48 hours, you can have the person manifesting with dehydration. And this is potentially life-threatening. And then, like I said, it's characterized by acute large volume diarrhea. So this person is well, the next, maybe the incubation period is between 2 hours to 5 days. So he ingests this within 2 hours, and then the next thing you see him vomiting. There's an initial vomiting, which is not all the time, but the next thing you see this person pooing and large volume. And the main challenge there is the dehydration, especially among those that are less than 5, pregnant women, like you said, immunocompromised. But babies have a relatively large body, so when they lose water, they easily go into dehydration. And that's why a lot of mortality that happens in this age group.
Okay.
And then, like you said, in pregnant women, you know that anything that compromises dehydration can lead a woman to losing his fetus, losing the pregnancy, going to acute, have losing the baby. So this age range and these people are the ones that really, this is affected. But anybody
Can be a victim
be a
of
victim.
cholera. But then,
But-
what's the situation in the country
Okay.
right now? The situation of cholera in the country, as well as can you tell us the states that are highly affected by this cholera of a thing and why?
Right now, according to NCDC, according to their 29th week report, which is very much online, the 27th week report says that 33 states have been affected. Right now, it's talking about 34 states that are affected. And then 56% of the infection is actually in Lagos, where they have about 1,500 persons that are already down with cholera. And then you have states like Lagos, Cross River, Imo, Nasarawa, and about 11 states now are highly affected. And then, so you have, like I said, you have Lagos State, you have Cross River State, you have Bayelsa, you have Nasarawa, you have Imo, you have Zamfara, you have Katsina, then you have, I can't remember, by 11 states. But right
But
now,
why
that's the question. Because when there is an epidemic, although cholera is endemic in this environment, but you know that in an endemic area, you can also have an epidemic. Cholera is endemic in this environment, and especially in the beginning of the rainy season, you expect because of, like you mentioned in your introduction, cholera is a disease of poverty per se, or is a disease of poor infrastructures being in place. So that's why it's more of a disease of developing countries. If you look at the global picture of cholera, see that it's most of in the right now it is in Africa and the eastern states, Southeast Asia. That's where you have cholera mainly ravaging. And right now it's the main challenges in Africa. So, like you said, you look at the situation around, you realize why cholera is endemic in our environment. Number one, cholera is focused in aquatic environments.
Okay.
So this is most times where its reservoir is. So when you have issues of flooding, when you have issues where waters are raised, you have it coming in from the aquatic environment, flooding in, and then all the groundwaters are contaminated. So, and then again, like you in your introduction, cholera is a disease of water. Then our hygiene,
Poor hygiene, yeah. Sanitation.
and then again with our refuse disposal system. So these three things are the challenges we have in this environment, and we all know that these are serious challenges.
Yeah.
And then when flooding comes, it worsens the situation and flushes this organism into the environment. And like I said, it survives in aquatic situation in environment. So you have the environment, you have the milieu. That's why it's endemic in this environment. And like you said, the situation in Nigeria is that, and that's what brings the question. Because when you talk about an epidemic, where is the focus? Well, from where is it spreading to all these states? have we been able to locate where the focus this time around, where it comes from? Like in Lagos, they are talking about from a tiger nut product, Konoaya, a
Mm.
tiger nut product. That's what they're saying in Lagos. If you look at some of the investigations in Kano in 2019, so yes, they were talking about water vendors, instance,
The
and
normal
then
sachet water
no
and all
water
of that.
vendors, those who go, this Kura,
Okay, Merua there.
vending
Okay,
water,
okay.
yes, and then also tracing it to the idea that a lot of persons will not wash their hands before eating, and then how we bring water when we want to eat. Everybody, the water is there. Everybody dips their hand in to wash, and so that is a source of spread
Hmm.
for it.
Hmm.
So
But can you give us a statistics of the total number of reported cholera cases and deaths in Nigeria since 2020, if possible?
that's a difficult one for me to answer. But I would let you know that the cholera epidemic has been in Nigeria since the early 70s. Between 1970 and 1972, that was when it was discovered. And it's been like, later on it became like something like every 4 years. But this time around, it comes like in every 3 years. And then even now, every year you have the epidemic of cholera. Last year's case was worse than this year's case.
Oh,
Last year, they talked about a case fatality rate of 2.9. This year, they're talking about, by the week 27, by NCDC report, we're talking about a case fatality rate of 2.9 last year. And then this year, they're talking about a case fatality rate of 2.8, which is
wow.
relatively insignificant. But, but you will see that over the years, the surveillance system in Nigeria is getting better. And that's why data is getting better. That's why we're
Okay.
having this report. You also know that there was a time in Nigeria, I think in 1991, when they said that the case fatality rate even rose up to like 16% or something like that, or 12% if I remember. But in areas that have this challenge, WHO is not expecting a case fatality rate to go above 1%. Because if you look at it, yes, cholera, 80% of persons who get infected with cholera will not manifest with symptoms.
Oh,
Yes. And then 1 in 10 of the persons who manifest with symptoms are the ones that will come down with severe diarrhea. That's why WHO is expecting a case fatality rate of not less than 1%. So it's just that when you look at the population that it affects, and then when you look at the people that it affects, it comes into semi-urban communities,
mm.
it comes into commercial areas, it comes to, when people emigrate to an area like that, and then you expect overcrowding in such places. And then in 2023, 2021, 2020, 2021, 2023 in Nigeria, the challenges were in IDP camps, in overcrowded camps. And that was why in those days it was in Borno, Adamawa, Yobe. Those was where you had those challenges in those days. But that's why the question is, why Lagos this time around?
Yeah.
Why Lagos this time around? But Lagos, especially they say in Etiosa, according to the data, they say that they are tracing it to a tiger nut product that is not NAFDAC registered. But there are so many of such around. So that's the question that has not been answered. What is the source of this one this time around? But
Okay.
when you understand that, if you look at like you're talking about challenges of climate change and things
Mm-hmm.
like that, you notice that these days our seasons are not the way they used to be any longer.
True. Very
You
true.
had a particular rainy season, a particular dry season in those days, but these days you have a season, you just have a particular drought, and then when the rain wants to come, the rain comes in floods,
Yeah.
and floods are everywhere. And then you see the drainage system, especially in Lagos. Yes, thank God the drainage system in Lagos is gradually getting better, because right now what you use to measure the drainage system getting better is that when you have a heavy rain, there's a there's a possibility of a flood.
Mm-hmm.
But within an hour or 2 or 3 hours of that flooding, if you see that the whole water has been drained, then you know that the drainage system is gradually working. And that's what they have started experiencing in Lagos.
Oh,
But
that's
that
good.
aspect of the flooding brings in a lot of these aquatic things. Vibrio cholera is the only one per se that is pathogenic among the Vibrio species. especially in disease causing, in diarrhea causing. The other vibros can cause other things. But so this comes in from the ocean and is washed into all the waters. It's washed into the wells. And like you said, our systems, you see pit latrines that are not too far from water sources. You see the way we get water. Even in Abuja here, how many of us can boast of clean water? How many of us can boast of? How many of us have pipe-borne water in our houses? Most of the houses in Abuja are using borehole. Yes, borehole are supposed to be good water because it's good. The depth of water is further down. But a lot of places are in this Abuja that are using well water and are also still using rivers. Although the case fatality rate in Abuja is very, very low. Even the suspected cases in Abuja have been very, very low as compared to Lagos, as compared to Katsina, as compared to Zamfara, as compared to Cross River, as compared to Bayelsa, and all those other states.
Wow, this is really eye opening. This is really really you've said a whole lot. But then I want to know what's the economic burden of cholera on Nigeria's healthcare system?
Oh well, I am not an economist,
But you are in the healthcare
and I am not,
system.
and I don't practice ergonomics. But let me try and see how I can answer that question.
Okay.
You see, it's not a direct relationship, but you look at it from most Nigerian patients received their care from out-of-pocket expenses. So when you look at it on the economy, this is hitting hard on them.
Very hard.
Although the government has put in a lot into the control of cholera this period, but one is out of pocket. Two, when you look at the level of literacy, because yes, it's only when you are literate you will know the right thing to do. You will know that it would depend on the level of your literacy. You will know that when you will be able to recognize the symptoms and signs, which I'm sure everybody knows, it is the symptoms and signs are you see somebody having acute watery diarrhea.
Yeah.
And this stool is described as rice water stool. Well, let me describe it for you the way I want to describe it.
Okay, please go
that
ahead.
When you soak gari in water, what you have, the top of the gari that you want to throw away, yes, that's what
the stool
the
looks
stool
like.
looks like.
Okay,
Yes.
viewers, I'm sure you got that description of what the stool look like. So when you see such a thing, you should know that person has cholera.
That's what we describe as rice water stool.
Okay.
And you notice that this person starts going frequently. Then you know that, and because when you look at the case definition, suspected case definition is for anybody who's above 5 years old, although when it comes to an epidemic, the age is reduced to 2 years old, who comes down an acute diarrhea, acute watery diarrhea, in an environment that is already having a cholera. The case definition says that is a suspected cholera. It becomes a confirmed case when it gets to the hospital or gets to a diagnostic center and it's confirmed that it is Vibrio cholera 01 or 0139. It's a confirmed case. But in an epidemic or in an endemic situation, it is good enough to suspect. So when you have a suspicious case, first thing is, what exactly are you supposed to do as a person when you come into this kind of thing?
I was actually about asking that.
Most persons, like I told you, 80% of persons will not be symptomatic. And just 1 in 10 of persons that are symptomatic that come down with the severe form. So when you talk about the symptoms, it is the diarrhea. Some persons will manifest with vomiting. And then because of this prostration, because of this vomiting, diarrhea, the person may now have muscle pains, muscle cramps. The person may become weak. The person may become febrile. So these are some of the other things. The person may have low blood pressure. The person may go into shock. But all these are because the person has lost a lot of fluid. So what exactly do you need to do? At that point in time, even if the person is vomiting, if the vomiting is not a bilious one or continuous one, you continue to give the person fluid. replace the fluid. That's the mainstay of therapy.
Hmm.
And then, so let me go back to that, your question about the burden
Mm.
on the health system. First and foremost is an out-of-pocket expenses most Nigerians do. Two is that drugs are pretty expensive these days, but
Very
let's even
expensive.
look, and then healthcare is no longer cheap, although the government is putting in facilities in every state to handle this epidemic, which we'll talk about when we get there.
Mm.
But when you also now look at it, that the burden on the already stressed healthcare system, the Japa syndrome has hit the healthcare system so much that in places where you used to have like 10 doctors, you may not have more than one doctor. So what the other job that this one doctor is supposed to do is not able to do them any longer. He now has to attend to cases of cholera because it's an emergency. If you don't attend to them in your very eye, the patient will die.
Wow. And that's not something any doctor would want to experience.
Oh,
Yeah.
and then from January to now, the suspected cases have been 2,809 as at week 27, and as at week 29 is 3,623. And then you have 82 deaths so far. So if you look at that case fatality ratio, it gives you 2.9%.
Wow.
So that is already a very, very high case fatality
It's really
ratio, because I
scary.
told you that WHO says the case fatality ratio should not be should not be more than 1%.
Okay, but then I just want to ask you talked about what people can do before assessing the medical health whatever. You said keep replacing fluid, and is that just all they can do? They can't give any other thing, just fluid, and then of course as you keep giving fluid, the person keeps passing stool, and then what else, or is it just fluid?
The mainstay of therapy for cholera is fluid replacement.
That's just it.
But there are other things that can come in the management. There is a place for the use of antibiotics, but it comes in secondarily,
Okay.
because if you understand how the diarrhea comes, like I told you, it's an like a I'm trying to find the simple word to use it. We call it osmotic diuresis. It's because of toxin. The toxin gets into the person's system and makes the person not to be able to concentrate water again in his body.
Okay.
So the water just keeps pouring.
pouring.
So what do? You keep replacing the water. But like I said, it is only in very, very severe cases we start thinking of giving antibiotics. And those antibiotics, when we give, it is to reduce the number of days of shedding of the bacteria. It does not, the antibiotic does not have anything to do with toxin that is already there any longer. The toxin will run its effect. So while the toxin is running its effect and making the person pour out water, you continue to replace the water. So that's why in the management of it, especially in most of the cases, especially in 90% of the cases, ORS is good enough.
Okay.
Whether you do the commercially prepared ORS or you prepare the ORS on your own. But the challenge again, the major challenge with cholera is water.
Water, clean water, exactly.
So you must also make sure that it is clean water you are using to prepare the ORS.
Okay. Earlier you talked about the government, the Nigerian government, doing something. So I just want you to elaborate more on that, on how the Nigerian government and the Ministry of Health have been responding to these outbreaks. What have they been putting in place, to help the masses and to also help the healthcare system, combat cholera?
The National Center for Disease Control, or the Nigerian Center for Disease Control, NCDC, is a parastatal under the ministry that is in charge of such epidemics like this, and they have been on top of it. And cholera starts and then gradually builds.
Okay.
Right now it is waning, but the government, seeing what is happening, decided to be proactive about it and formed a technical working group. They call it the National Cholera Technical Working Group. This technical working group is made up of so many ministries for inter-ministry collaboration. You have the Ministry of Works, Ministry of Water Resources, Ministry of Information, Ministry of Education, so as to handle the educative aspect of it. Then you have Ministry of Aviation. You have so many ministries, Ministry of Planning. You have so many ministries coming together, and with development partners, WHO, CDC, UNICEF, all coming to work with the NCDC as a team to militate against this cholera outbreak. So you have this team in every state. Normally, when there's an outbreak, or normally when there's a reportable disease, there's a surveillance system in place. There's a local surveillance nurse or local surveillance officer that is attached to every locality that takes such data. And this data gradually goes. But now, because of the situation here, the NCDC, along with this committee, is in place in every state, in the 36 states. Even the states that have not reported any cholera outbreak are already in place there. And they have centers. There are designated centers where anybody who has this condition is taken to for diagnosis, rehydration, and treatment. So, aside this, the government had also ordered for the vaccine to come.
Oh, beautiful, beautiful.
The oral vaccines are ordered. But you know, the Gavi, that the initiative, that's the Vaccine Alliance Initiative, where every nation can sort vaccines from. The government has approached them as of June and had asked for these vaccines to come. Although vaccines are not 100% effective in management of cholera, but they are adjuncts in the management of cholera.
Okay.
Because the vaccines also has to do with your body's immune system to respond. Because these vaccines cause a response in you so that anytime the cholera comes, the response is already there to tackle it. But it cannot be 100% effective. That's why a lot of things are being put in place. That's why this inter-ministerial collaboration is to tackle the issue of refuse, the issue of indiscriminate open defecation, the issue of water shortages, and supply of clean water. So these are all the issues, because you know that the three major issues with cholera is just what you elaborated in the WASH analysis, and there's a WASH project: water supply, sanitation, and hygiene.
Sure.
So these are the areas where the government is also working to improve. You know that recently there has been an act of parliament about open defecation.
Yeah.
Yes. And if you look at the statistics, you find out that close to 20-something% of Nigerians practice open defecation. You may wonder that, okay, is Abuja, maybe just the ones on the road. But when you get into the hinterland, you find out that most persons don't have toilet facilities. They go into the bush. So open defecation is practiced. And then, how many Nigerians have access to clean water?
Quite few.
So these are the challenges. That's why you see that every year we continue to have this challenge of the cholera epidemic.
Okay, that's really very, very robust. Viewers, the big question here now is, what can be done to prevent cholera in Nigeria? I'm sure you want to know the answer to that question. We'll be taking the answer immediately after this break. Please don't go away.
Now streaming, now analyzing, now assessing, now discussing, now sharing your thoughts on everything and every issue that affects you. ACNN's Now Streaming discusses the issues trending and the matters that matter to us all. Join us every Monday to Friday at 10 a.m. on ACNN as we go in-depth into every issue that impacts our lives, our communities, and our country.
Welcome back. If you're just joining us, this is Health Watch on ACNN TV. And I still have with me Dr. Samuel Adedayo Shobare, and he is the consultant medical microbiologist and also the head of department medical microbiology department, National Hospital Abuja. And we're talking about the topic and the Nigeria endemic, the cholera outbreak and its danger to human life. If you've been following this program, you know that we've really had a whole lot, so much information have passed down to us. So before we went on break, I asked a question: how can cholera be, prevented here in Nigeria? So I'm sure Dr. Samuel has an answer to that. How can we prevent cholera in Nigeria? It's I read somewhere that it's preventable. So maybe tell us how we can do that.
Yes, it's preventable.
Okay, how can we do that?
Let me look at it from as a Nigerian. How can I in my house prevent cholera coming before I now look at it as a doctor?
Okay.
In my house, first, I want to make sure that I drink clean water.
Okay.
So, if it is well water I have in my house, can I chlorinate this water? Can I boil this water? If I have a challenge of, okay, how do I boil it? Can I just buy chlorine tablets and drop it in it? Chlorinate this water. Or if I'm a big boy, maybe I'll just drink bottled water. Because let's look at it. Even when you talk about pipe-borne water, how safe is your pipe-borne water? Let's just be realistic about it. Look at Lagos State. That's part of the challenges they had. Their pipes were passing through gutters. And then how many years will this pipe have been that rust and things like that? And then there won't be leakages. And then sewages will not find their way into these pipes and get into people's houses. So how safe is even my pipe-borne water? Pipes that are leaking, pipes that are busted. And then when you now have flooding, and then you have these pipes on the surface, and then it carries sewage. First and foremost, we need a lot of education in Nigeria. We do a lot of disadvantage to ourselves. You'll find out that somebody thinks he's smart, he packs poo, sewage from another person's compound. And he goes to drop it. Maybe in a bush, he feels that nobody's living there. And then the rains come and wash that poo.
And bring it back.
Back it back into our community. So let me now say, let's look at clean water. How do I make sure I get clean water? With whatever water I get, maybe I just add chlorine tablets to it. Or I filter my water. Or I boil my water if I have access to be able to boil it. Or if I can guarantee the bottled water I want to drink, all that matters is I try my best to give myself clean water. Even if it's the river water that I'm fetching. Even if the rainwater I'm fetching, can I make it clean? So first is to make my water clean. And then to also make sure that the containers that I'm putting the water is also clean. That's about water. So then the next thing is sanitation. I make sure that my feces or my poo are flushed very well. Or bury the feces at a depth that is deep so that it does not easily get washed back to the surface. And then when I want to use a toilet, somebody has used the toilet, I make sure that the toilet seat is clean. I clean it with water, or I get tissue paper and I clean the toilet seat before I use it. Because it's a lot of us, you see, cholera, we say is fecal-oral. What do you mean? That means from feces to mouth. A lot of people will ask you, how can something from feces get into my mouth? But they don't understand the intricacies. If I go to use a toilet and I bring the toilet seat down with my hand, I put it down, and the toilet seat that is already contaminated, and I leave that place, I don't wash my hand, and I put my hand on the toilet handle, I open the toilet handle, and I leave. Maybe I then go somewhere and wash my hand. Another person comes and opens the that toilet handle, and has taken the cholera or whatever is taken from there. So that's how, most times when you look at fecal-oral transmission, yes, it can be from raw vegetables, can be from raw foods, you understand? Although we say that this one is from contaminated water or food. But it can even be from our practices, our hand, our hygiene. So these are ways by which such things transmit. So the use of a toilet, if somebody has diarrhea in the house, make sure you know how to clean that. so that it doesn't become a source of contamination to everybody
Others.
around. That's one from my own end as a person. Then I make sure I dispose my waste very well. Because if I don't dispose my waste very well, a lot of persons, you see a lot of waste in Abuja here, you see Pampers.
Yes.
You see Pampers. You see a lot of persons, you see their sewage. They put it maybe on a refuse dump and things like that. And this thing is lying there, and the rain comes. And you think you are throwing it far away from your house, but the rain comes and washes it back to your house for you. So the idea is that I also must do proper sewage and then proper waste disposal. Then I also must struggle with my personal hygiene. And then again, I try to eat good food, because again, our level of what's the word now? Our level of immunity also has a lot to play. It's been said that cholera, for persons who have maybe peptic ulcer diseases or have gastritis, or have vitamin B12 deficiencies and things like that, vitamin B12 helps to maintain the stability of the mucosa of the intestine. When these ones have a challenge, then when the cholera enters, it has an easy way to enter.
Yeah.
So for me, if I maintain good personal hygiene and I eat well, my immunity will be able to take care of this. If my body is in good order, when a stress of this kind of diarrhea comes, my body then will be able to cope. But when somebody's body is already in some malnourished state, that's why it comes more among children that are less than 5 years, because their body don't have so much reserve, and then their body water is not that much. So when they lose this amount, they easily die out of dehydration and electrolyte imbalance. So again, food safety practices. For me in my house, I make sure that I wash the fruit. I make sure that I don't get too hungry that I just buy fruits on the way and I start eating it immediately. Sometimes we get deceived. You see that the person that is selling the fruit is pouring water, washing it in your face. How sure are you of the cleanliness of that water that is using to wash it? So you just go and buy it. You say, okay, he gave me water. So yeah, give me water, let me wash. Do you know the source of the water he has used to wash that fruit? So that's why the onus is on you to make sure that you maintain food safety practices. Then when you now talk about, let's look at the community.
Okay.
Then the community now has to come in as their brother's keeper and do some community engagement. That's when we talk about roles of religious leaders, roles of our traditional rulers, you understand, coming in to do community engagement. Yes, the government is also doing enlightenment, but the community itself goes and enlighten the people. You see this kind of thing, you report, and then the community can also come together to improve their water source. Now let's talk about the health response. One of the things that is needed in the health response is the provision of vaccines. So when such situations come, and that's why you notice that these vaccines, some of them are licensed in the US where they don't even have the cholera.
Yeah.
But they license it in such countries so that any of their persons going to Southeast Asia, coming to Africa, going to areas of cholera endemicity would have taken this, because it is believed that when you take the oral vaccine, within 10 days it becomes effective. And some of them, if you take 1 dose or 2 doses, can last as long as 2 years, some up to 5 years. But it's not a lifelong, it doesn't confer lifelong immunity. So that's why one of those things we want to do is that for a country, we need to, the only thing is that you look at, okay, the response in Nigeria is much better now. The surveillance is also much better. So it is believed that it is not as difficult as it used to be. So keeping such things sometimes may expire in your hands, except when there's a need for it. And since there's a pool and a vaccine alliance where you can always get, so you don't actually need to keep such things. So for medical response, that's one. Two is that healthcare workers have a high index of suspicion. so that they could quickly recognize suspected cases. Even community people have to
Okay.
also have a high index of suspicion to quickly recognize suspected cases. And it is what you do before you bring the person in. That's why, like I told you, 90% of cases of cholera may not even require hospital admission,
Okay.
because when you give them proper rehydration with the ORS, not Coke, not Fanta, not anything. Yes, with the proper ORS. When you give them proper rehydration with the ORS, they get over it. The ones you now have to now bring out the ones that actually require hospital admission, and those are the ones you may have to set up infusions for them.
Okay, you talked about a whole lot of what the traditional leaders can do, and the religious leaders and all of that. Now that brings me to ask: have there been awareness campaign with regards to cholera? I mean, recently in Nigeria, as well as campaign for vaccines. Have we had them recently in Nigeria, and how successful have they been? If we have.
Well, let me go back in history to tell you that vaccines have been used in Nigeria before. In 2017, I think it was used in Adamawa State. So, and I explained to you that these vaccines are not part of our routine immunization schedule. And most times there is no reason for you to store it except there's a need for it. As we become proactive, like you said, in our surveillance and things like that, as we become proactive, we'll come to realize that this thing is endemic. When we're getting to January, maybe in December, the Nigerian government would make sure that this is procured and people get to use it in preparation for the heavy rain, for the flooding, and for the coming of cholera.
But then instead of waiting till that time, because I know we give children vaccines in the hospital. You say this is for measles, this is for polio, and all of that. If this cholera vaccine can last maybe 1 or 2 years, can't the government say, okay, let everybody get it? So you know that for 1, 2, or even if it's 3 years, you don't have to stress through all of that. After that period, you can still now order for some more.
I agree with you that we should get to that level where this is made available before the rainy season.
Exactly.
So that persons get to this. This is part of what the government should be doing. Right now, like I explained to you, that the government has ordered for the vaccine. And if you look at the population that has been affected, we're talking about 5,000 persons. We're talking about 1,500 in some places. And when we're talking about 200 million persons. So there's still a place for the use of the vaccine when it comes, when the government brings it. So we're awaiting it. The government has ordered it.
Okay.
But the major thing about cholera management is those other things we talk about: water, sanitation, and hygiene.
Okay, that's very, very essential, very, very important. So, but then I know our time is really fast, but I just want to ask, how can individuals contribute to preventing the spread of cholera in Nigeria? You've talked about hygiene, water, sanitation, but then we know in real sense, in all sense of it, that people living in the IDPs, people living in these rural places that can't access water, clean water. Even if you dig the wells, they defecate around. They can't. How do you think Nigerians can come in to contribute in the prevention of all of this?
We all have to come to understand that yes, it's a disease of impoverishment.
Yes, it is.
It's a disease of impoverishment, but that does not mean that somebody who is rich cannot come down with cholera. So all of us can be affected. So all of us have to, first and foremost, it's about the education. Everybody has to know what do I need to do to prevent cholera. The first is cholera. Vibrio cholerae has a sanctuary in the ocean, has a sanctuary in the rivers, especially waters that have high concentration of salt. And if we prevent, the major thing is about indiscriminate pooing. So if this sanctuary is not populated, we will get over this. But the moment people continue to pull indiscriminately, the rains will come, the flood will come, will carry it into the sea, and it will be a sanctuary there. And then when flooding comes, this will come back to us. So the first thing is the education.
Okay.
All of us must come to the education that we must find a way of being better with our personal hygiene. That means we must be more discreet in the way we handle our sewage, especially our sewage. There must be a way, if it's going to be a pit latrine, dig it deep enough and be able to take care of it. If you go to the NCDC sites, you will see they describe for people who cannot afford to do the standard toilets. There are ways they do pit latrine, and then there are ways you also do hygiene when you leave that place. So we have to gradually, as individuals, start passing the message and then be a brother's keeper. If I know that the malam living in my house does not have a toilet, and I have, maybe my security has a toilet, I'll tell him to use so that I can be protected. Because the major thing is about indiscriminate pouring, indiscriminate passage of sewage in the environment. Because it's fecal oral, it has to come from human. It is not like typhoid that has a human storage. It's not like typhoid that has a carrier stage in human being that can stay. The vibro cholera gets in and goes out. It does not have a reservoir in the human body. Okay. And so if we take care of its reservoir, we will be able to take care of it and it will not become an endemic situation. But again, so far flooding continues, it will always bring this into and then contaminate our surface waters and to there. So as individuals, let's do our own bit. Let's try to keep our personal hygiene. If it's possible to take the vaccine, take the vaccine. And then prevent. And then, like I told you, the major issue, even in hygiene, is some things that have to change in our culture. I go to eat and they give me water in a bowl to wash hand. And they carry the same bowl to another person to wash hand. And it's our tradition. It doesn't matter. But if we find a way of being cleaner in our hygiene, when we use the toilet, we find a way of washing our hand regularly before we leave the toilet. Make sure our food, we make sure we wash them very well. And then, even the washing, like I keep saying, let's make sure that the source of the water we are using to wash is not contaminated water.
Okay, you know what you said really got to me, because I know I've been to a very very rural place, and you need to see when they give us water to drink. When I looked at that water, I knew I couldn't even wash my hands with it. It was so brownish, almost reddish in color, and that was what they were drinking, and I felt so bad. I'm talking about a village in Kaduna State. Okay, so I felt really bad. And now that, to add to what you just said, I want to encourage for those whom God have blessed and you have the passion to help people, because like Dr. Samuel rightly said, be your brother's keeper. There's nothing wrong in helping build dig a very good borehole for these people so that they can have access to clean water. And if it's the toilets you can help them build, you can also do that. That is you going out of your way to be your brother's keeper. And when the vaccines come, if you can afford to give them vaccines, fine, why not do that? So we're appealing to all meaning Nigerians, all goodwill Nigerians, to please look for a way you can help to contribute your quota, because cholera is really not something that we want to hear happen to any of us. We don't want anybody to contact cholera, because it's like Dr. Samuel pointed out, it's not a funny thing, but then it's preventable. That's the best part of it, because from everything Dr. Samuel said, it's preventable. Well, am I talking out of point?
Yes,
it's actually preventable. So why can't we prevent it? So if you have a way of helping out, please go ahead and do that. Now, Dr. Samuel, before I let you go, I want to know regarding sensitizing Nigerians about cholera outbreak. is there a connection? Is there a collaboration between cholera, typhoid, and what's this other, all these other waterborne diseases? Are they somehow interwoven?
Okay, I will answer that, but let me say something about the water you were talking about the brown water and things
Okay.
like that. Actually, the government is also doing things about water sanitation
Okay.
and then clean water. You know, this has been an endemic thing. So, especially in the northeastern part of Nigeria, there's some organizations like the International Organization for Migration, then some governments have developed some boreholes that are solar powered
Oh,
for
beautiful,
such
beautiful.
communities like this. They have so and I think in one of the states they developed about 58 of them in 2019.
Mm.
Yes, I think in Adamawa State, if I'm and maybe Adamawa or Bono developed this sort of things for them to take care of such challenges, like you said. Because already looking at the color of that water, you know that water is
It's
not
terrible.
clean.
It's not clean, not at all.
So coming to your question about
Waterborne
yes,
diseases
waterborne diseases
and
like
cholera. Do
cholera,
they share the
typhoid.
same parents?
They are waterborne diseases, but they are different. That's why you see that typhoid could run all around the year because you have a reservoir in man.
Okay.
Yes, it is fecal oral. Fecal oral means from the feces it
To the
goes to
mouth.
the mouth. That's how it is spread. But like you said, it's also a disease of unsanitary habits, poor maintenance of sewage and things like that. But why it runs all around the year in typhoid is that there's a human carrier to it. A human can carry it. But in Vibrio cholerae, there is no human carrier
As
in
it
it.
goes in, it
As it
goes
goes,
out.
it goes out. It doesn't have a carrier state in man.
Okay.
And then when it goes out, it goes and it has its reservoir in the estuaries, in the rivers and things like that. So if there's no reason why where it is where in its estuaries where it gets where it gets back and contaminates drinking water, it won't come. That's where it is preventable.
Okay.
If we become very proactive in situations of flooding, we wait for the water to settle down and then we decontaminate all the surface waters. You have wells and everything, you chlorinate them and you decontaminate all them. In that period, the government or individuals and everybody will take charge and make sure that any water you want to drink, you either chlorinate it or you filter it or you boil it, because you cannot be sure that your water has not been contaminated. But if we have a very good pipe of water system that is managed regularly, and pipes are changed, are maintained and things like that, we will definitely overcome this.
Okay.
So that is the difference between cholera and typhoid. Cholera has a seasonal approach to it. Typhoid does not have a seasonal approach to it because it has a human carrier
Carrier.
in it.
Okay, that's well understood. So, let me ask you lastly, what advice do you have for our viewers, for the government, and for all Nigerians with regards to cholera?
Well, my advice to Nigerians is that this is our country.
Yes, it is.
It is what we make of it that it becomes. Cholera is not a problem of only Nigeria. It's a problem, right now, it's a problem of Africa itself and Southeast Asia. You have the Comoros Island, you have in the Philippines and all those other places. You have it as in Afghanistan, you have it as problems in all those places too. So we all have to come together to fight this scourge. It is preventable. Do your own bit. Look after your neighbor. Look after yourself. If the vaccine is available, take the vaccine. If the vaccine is not available, make sure that your water is clean. Make sure that you take care of your personal hygiene and take care of refuse. Our idea of indiscriminate dumping of refuse, we ourselves can make things work. It is not just about government. If I decide that this thing is a health challenge to me, if If I dump that refuse there, is a health challenge to me. I'll be mindful of what I do. And let us educate everybody about this. And that this disease is not that serious, in the sense that it rarely leads to death if you do the right thing. The right thing is that you see somebody who is already purging, let the person start rehydrating himself and go to the nearest healthcare facility to get assistance. Thank you.
Okay, thank you very much, Dr. Samuel. I've so been well educated here, and I'm sure our viewers out there have been educated. We truly appreciate you giving us a little bit, a tip of your wealth of knowledge. We really appreciate you. And as we conclude our discussion on cholera in Nigeria, let us all remember that this preventable disease continues to pose a significant threat to the health and well-being of millions of Nigerians. Now, while progress has been made, more needs to be done to address the root causes of cholera outbreaks, including inadequate access to clean water, sanitation, and hygiene. And let us continue to raise awareness in our little ways. Every little way you can, educate somebody, support efforts to strengthen the country's healthcare system, and also advocate for increased investment in WASH infrastructure. Together, Nigerians together, we can reduce the burden of cholera in Nigeria and move closer to a future where this disease is no longer a public health threat. Now, by working together, we can create a healthier, safer, and more prosperous Nigeria for all. Finally, I want to further encourage each and every one of us to join forces to make cholera history in Nigeria. Let's make it history. Let it be gone. And also ensure that every individual has access to the safe water, sanitation, and health care that they deserve. Okay, viewers, until we come your way again next week with another very interesting and educating episode on Health Watch, please ensure you stay safe, and bye-bye.